Lucy Barylak, MSW, has a master's degree in social work from McGill University. She is presently working as a consultant for a health network in Montreal, Canada. She has been involved in various research projects and has published numerous articles related to caregiving issues. She's lectured at several universities and colleges on innovative approaches to caregiving and presents annually at international and national conferences. Lucy's also a consultant for private industry in the United States, including her work with the WellMed Charitable Foundation and their clinics in Texas. In addition, Lucy would like you to know that she has been a caregiver for her mother for about 10 years. So with that, Lucy, Elliot, we're so happy to have you today.
Thank you so much, Evelyn. And thank you everyone for joining us. It's really hard to believe that here we are in March 2022, and it's the second anniversary of COVID-19's reported onset in North America. It's also hard to believe that COVID-19 is something we're still dealing with. Some of you might have heard news about fourth boosters, about a new Omicron subvariant that we're anticipating, and that parts of Europe and China are again seeing outbreaks. So we're certainly not beyond the end of the pandemic, not by a long shot. But I can't even count the number of sessions that Lucy and I have dedicated to the evolving pandemic since it began and how it's affected seniors, caregivers, and healthcare workers especially. We have lost more than 950,000 lives in the United States to COVID-19 since the beginning of the pandemic. Now, the good news is that COVID virus activity continues to wane across the US, and new case reports are reaching roughly, in some parts, their lowest levels since last summer. Fewer people are also being hospitalized with COVID-19, and fewer new cases are being announced each day, certainly than in the weeks previously with the Omicron variant having been dominant in the US. Many infectious disease experts are now saying that we're approaching what is known as the endemic phase of COVID-19, which means really that COVID, not that it's ending, but rather it will become part of our lives now, just not in as critical a way as it was at peaks during the pandemic ahead of our vaccines and antiviral medications.
Thank you for that, Elliot. Good morning, everybody. Thank you for joining us. You know, I'm hopeful that we've seen the worst of the pandemic and rates of the virus are falling and masks are now optional at many locations. We're seeing more people are going out to socialize, go to stores and businesses. That's part of COVID-19 recovery that we can see. What we can see are the ways so many of us are still struggling with the ongoing mental and emotional recovery from the pandemic. We shouldn't expect the physical and emotional recovery to line up, and it's important to respect the healing process. For some people, the pandemic has been devastating with worsening isolation and loneliness. It's creating anxiety for some and deepening depression for others. The pandemic has been hard on all of us, but for some, it's been devastating, worsening isolation and loneliness, creating anxiety for others, deepening depression. In addition to a rise in anxiety and depression during the pandemic, we saw an increase of substance abuse, domestic violence, and child abuse. Those will take even longer to heal. So, at this point, I'd like to ask the audience, how is your life different now from where it was 2 years ago when the pandemic began? Love to hear from you.
Folks, you can press *6 to unmute your phone, or you can just unmute your Zoom and talk to us. Love to hear from you.
It's a very loaded question, I know. And even if you don't answer it right now, it's something to think about. How has it affected you and how are you dealing with it at this time? And maybe we'll have an opportunity later to hear from you.
I've been spending a lot of time thinking about what we've witnessed over the course of the pandemic, and also what caregivers and healthcare workers have shared during the programs that we have facilitated. What have we learned about healthcare, caregiving, and our aging population during the last 2 years? For many years, we have talked about our rapidly aging population and our healthcare system that is poorly equipped to manage the growing needs of an aging cohort of baby boomers. All the while, very few of us considered the threat of a pandemic in that mix. These concerns about our aging population quickly became illuminated by COVID-19 because age has been the biggest risk factor for severe complications and death. High death rates of older people have characterized the pandemic. In April of 2020, over 95% of deaths from COVID-19 in Europe were among people over the age of 60. By February of this year, 93% of all COVID deaths in the US have been among people over the age of 50. Quite astonishing. Many countries initially tried to curb spread of the virus by introducing age-based measures that restricted older people's movement, something we didn't experience directly here in the US. But in the Philippines, people over the age of 60 were banned from using public transportation. In Bosnia, it was a punishable offense for people over the age of 65 and children to leave their homes at the start of the pandemic. In some countries, including the US and Australia, nursing homes imposed visitor bans. Now, we're certainly familiar with that. And some of those bans really resulted in potential neglect and also prolonged isolation. There were increases in the use of psychotropic drugs for older people in nursing homes in the UK and also in Canada. While these measures were taken to protect our elders, I think that they also came at a cost. At least 32 states made it harder for nursing home residents and their families to bring lawsuits against companies that run these facilities. Now, as much as technology has also enabled many of us to connect during this time as we are right now, it has further isolated some seniors who are not tech savvy. Though elders were prioritized for vaccines, as an example, some older people faced barriers to accessing them because it required registering for your COVID vaccine online. We've also talked about the role that Alzheimer's and dementia, how that may play a role in increasing risks because it's harder to remember to follow public health precautions like wearing masks and keeping distance. Yet there has been no prioritization for vaccines or antiviral drugs for people with Alzheimer's and related dementia. Now, as governments are shifting to living with COVID, older people and others are at particular risk because people aren't wearing masks and they may feel that they have to choose between staying at home or being exposed to some level of risk. As more people remove masks and those who are at a higher age or risk due to underlying health issues continue to wear masks, there's also a stigma attached to that too. I've noticed people staring at me at my local grocery store here in Florida, as I've been the only person wearing an N95 mask around. And that might only be my perception, but nevertheless, it didn't make me feel very good. I started to think that people must wonder what immunocompromised condition do I have, It also really made me think about how immunocompromised people will continue to feel in our quote unquote new normal. This puts new strains and new demands upon caregivers too that I think we haven't really recognized. Now, the question now is whether COVID-19 can serve as a long overdue wake-up call. The start of the pandemic's third year can and should be, in my opinion, the point at which we take account of the collective rights and welfare of older people and caregivers. Now, that's just me on my soapbox, but these are a lot of things I've been thinking about in preparation for our program today. And I wanted to also ask our audience, what are your thoughts?
We actually had a wonderful chat from Lisa, who's one of our participants today. Lisa, would you talk about what you said in your chat? she works in a senior center, and she said that, they were back running again, but, things look kind of good and kind of bad. Lisa, are you there? Would you talk to us? Oh, she doesn't have a mic on her computer.
Oh.
Okay. So do you want to put some more chat in?
I'm also wondering what people are thinking about this concept of us shifting to living with COVID as part of our daily reality. How's that making you feel when you go out and see very few people with masks on? Is it comforting? Is it a reminder of times before? Does it make you feel a bit of risk?
Folks, all you got to do is press *6 if you're on the phone. Oh, here's Lisa. People had changed mentally and physically when they returned. Interesting. I really identified with your comment about the grocery store, Elliot, because the same thing happens to me. The only ones in the grocery store wearing a mask are the checkout people and me.
Yeah, we were talking a little bit about that before we started with Evelyn, and I was saying that each person has to decide for themselves what makes them feel comfortable. I know that I'm not going to go into a grocery store yet without a mask on. So even though things have opened up, and if people want to stare at me, that's okay. But I need to feel safe.
I agree with you. And part of the attribution of higher outbreaks right now in Europe are being blamed on the fact that people are not wearing masks and taking the same precautions that they were a couple of weeks or months ago.
Our participant, Lisa, said that not everyone has returned to the senior center. So I'm sure there are some of those who feel like they might be at too much risk. Mm-hmm. She said masks were recently made optional for the time being, but most people are still wearing them. Thank you, Lisa.
Hi, I'm Kate, and I'm going to answer this question about how I feel about the shift toward living with COVID as part of our reality. I'm kind of, it's better than being locked down, I suppose. But my fear is, as somebody else just said, that we're doing this too quickly. And that we're all going to be locked down again in 2 or 3 months after we're back together. And it's frustrating to me that not enough people are wearing masks.
Yeah. Ella's in the chat room saying that when she goes out, she's one of the few that's wearing a mask. But she always goes to public places with the mask on or contacting people outside of the house. And I think that's probably pretty normal for most of my friends in my age group. They do the same thing. Thank you, Kate.
I'm still wearing a mask, and I think I was probably the one that was probably the scariest person in my office area. So I have to reflect on that for myself. Like, there's some people around here that's not vaccinated or boosted, we call it. So I find myself being a little carefree, but when I go to grocery stores, I still wear my gloves and I still wear my mask. I think Elliot said you have to do what's safe for you, but I don't know. I think I've let up a little, and that's kind of concerning. I'm so ready to be back to normal, and spring is just around the corner. So I might be done got caught up in the hype. I don't know, but I'm the only one to my knowledge that have not got COVID in the area.
I really, really appreciate everything that you and everyone else has said. And I feel you. I want to take the mask off and feel like life is back to normal. but I think maybe it's just because I work in public health and I'm around seniors, I'm just more sensitive. And I don't want to be part of that, that potential risk in transmitting the virus, and I don't want to get it either. So to me, it's an easy precaution. I do think, though, you can let go of the gloves when you go out, because the majority of research has shown us that COVID really is airborne and is transmitted through our breath and our respiration, not as much touching surfaces. I do keep a lot of hand sanitizer with me in my pocket, in my bag, wherever I go. I don't know that my cuticles will ever recover, but I know that my hands are very clean.
Yes, and I think it's so important when you walk into your house, the first thing to do is to go and wash your hands. That's really, really important.
And to find really good hand cream for those cuticles with all the sanitizer.
The anti-sanitizer hand cream. Ella's saying that she believes that that wearing a mask is becoming the new normal for people that are concerned.
For sure.
Yeah.
You know, as we're talking, it's obvious it's been very devastating experience for a lot of us. And all of our lives, yes, have been affected. Like with any experience, I think that Elliot and I both believe that there are also positive things that we could learn from this experience. So I want to share that. So for me, positive aspects that have come from this whole pandemic have included that I was able to monitor and deal with my emotions and feelings a lot more than before. So when I would get down, I'd recognize it, I'd say to myself, and then I'd find a way to move forward. I also found that I didn't realize how resilient I was and found ways to cope. One of them was by having regular daily routine, which I still keep to this day, that including eating well, exercising, sleeping, and not isolating myself. But the most important thing I'm really thankful for is that every day that I woke up, I was thankful for having a roof over my head, hot and running cold water, food, kind of put things into perspective. And the fact that my children and the people that I love were okay. So even though I always appreciated what I had, the positive aspect of what happened was, for me, it's daily. I daily feel extremely lucky to have the things around me. I was wondering, Elliot, how about you? Are there any positive things that you've learned? And I think maybe everyone should kind of think about it as well.
Sure. I think there are many lessons. Could be because I'm an educator and that's just how I think. But this is a teachable experience if we want to look at it that way. We have a lot to learn, I think, also from the experiences of caregivers so that we can better support them in the face of any crisis. We've learned patience, I hope. Some of us have learned some new strategies for being better caregivers or for managing our stress. For me, though, the pandemic has really made me focus on my own health. We've learned that being in good health and being proactive about our well-being has been critical to our survival in every sense. I think people in overall better health, and research certainly supports this, that contracted COVID fared far better. So I really made a very concerted effort to make health my priority. As soon as we went on lockdown and my gym closed, I started walking every day. I'd be the only person out in the streets, which was kind of nice, actually. But I think I walked over 100 miles during that initial lockdown period combined. And I really have continued that, making time to make exercise a priority and also learning new ways to cook tofu. And I've joked about this many times, not because I like tofu so much, but when we've had these food shortages, if you've noticed, there is always tofu in the grocery store because no one wants it. So it's made me become a little bit more creative and maybe a little bit more humorous. So I'm curious to learn what positive takeaways some of you have had, if you'd like to share.
Pierre had a chat room comment, which I thought was pretty interesting. And I think we all know that it's true just because of the news, that it really depends on where you live, on how you're dealing with COVID right now. Don't you think, Elliot?
100%. You know, it's been an interesting ride for me here in Florida. It's like the land before time, or the land where COVID just doesn't exist. It's very upsetting to see that our governor has suggested that children not get vaccinated, which is counter to everything that science is telling us. It does depend on where you live for sure. And you know, for example, my dad is coming to visit next week from Canada, and I've warned him, you know, that it's going to be a bit jarring, perhaps, to see how very different it is here, and that no one takes precautions as they do in Canada. So I think that's something else we have to be sensitive to, is the culture and the environment of where we are. We also need to be sensitive to the outbreak levels in our communities. That's one way of taking some control over what's going on. And so when we know that there are higher outbreaks in our communities, we can take appropriate precautions. And that information can be found on Google. Every health department has to publish what their current positivity rates are. We aim for 5% or less. Here in South Florida, we're at about 7% right now, which isn't too bad, but it's a good thing to be aware of.
Pierre also said that his nephew was the one with the Saints shirt on, where the governor asked the students to take the mask off. And he says it's ridiculous.
Thank you for sharing that.
You know, as time goes on, there's more and more research that keeps coming out about the role of mental health and cognition during the pandemic. You know, we shared a piece of research about memory that is worthy of repeating, just in case you forgot. So the pandemic has affected people's memory, if you don't know that, for sure. And this is true for all of us. If dates, details, and daily tasks are feeling a bit fuzzy these past couple of years, it's not just you, experts say. And I have to say, I felt it many times. It's not laziness or losing your sharpness. Being in a global pandemic for the last 2 years is actually making it harder for our brains to make and recall memories, according to neuroscientists. The situation for the past 2 years has pushed us to not do much and not to plan, and getting too used to life in the time can mean cognitive damage, memory disruption, and trouble maintaining attention. It makes a lot of sense if you think about it. If we're sleep deprived, if we're stressed, if we've got a million things on our minds, we're much more likely to be unable to remember something as sharply. We all had more stress on our plates for those who have gotten COVID and have experienced the brain fog that is sometimes described. And even for those who have not gotten sick, many of the aspects of living during the pandemic can inhibit your memory, but they can also be solved with changes you could make at home. So, you know, if any of you have been feeling it, it's really, really normal. So what I want to kind of focus on, let's look at the word shield, okay? So S is for sleep, H is for handle stress, E is for exercise, I is for interact socially and learn something new, and D is for diet. Now, sleeping adequately, exercising for at least 20 minutes a day, maintaining a daily habit, and managing stress with relaxation or meditation techniques are all important for keeping blood flowing and inflammation minimized in our brain. I know we've talked a lot about this, but this particular research really, really emphasized for us the importance of doing these things for our brain as well, not only for our physical well-being. As if you are experiencing brain fog, it may be helpful to cut out alcohol and recreational drugs for the time being to reduce the inflammation that could be making it worse, okay? It may be tempting to numb, the stress or sameness of the day, but it's important to try to keep up social interactions and learning new things, whether starting to read a new book, taking up a new skill, or even just walking around your neighborhood and noticing something you never noticed before. Really keeping our minds. Now, I know me personally, through the pandemic, I was watching a little bit too much Netflix and decided to cut it out and started reading again because I want to make sure, even though I'm extremely fortunate to be able to still work and do research and actually work towards these podcasts that we're doing, I did decide to do that. And not only that, but I also decided to take a course on my computer skills, which are not that great. So I just want to know, has anyone found it more challenging? And did you decide to do something a little bit different to enhance your brain power? Let's hear. I'd love to hear some things from
Yes. Please feel free. You just press *6 if you're phoning in. Unmute your phone. If you're, unmute your Zoom if you're Zooming in. We would love to hear from you.
I have been watching Jeopardy religiously. I think that is sharpening my brain power.
Yeah.
The other thing too is, if you don't mind me adding this, it's anxiety. Because people are anxious and you get all of those bad hormones going, that increases your inflammation. It increases your depression. So to do these things that you're talking about, the shield, are really helpful. And to, I think like a daily examination of how your mood is and how you're doing and how you can, like you said, Lucy, figure out how to do something different. Glenda and I talked and she goes, yeah, you and I get down, but we know that we got to pull ourselves up and go for a walk. and it works.
It does. It really does work.
The other tip that I really like is jotting on a Post-it note at the end of the day or the week, something that you felt grateful for, and just keeping a track of those Post-it notes. After a couple of weeks, you'll start to see a theme emerge. And what is the focus of your gratitude? And that can be very powerful.
Yeah. I think that Pierre had a little chat. I didn't get a chance to. Could you just check it out?
Yes, I can.
Pierre said that he takes vitamin D3, zinc, and other multiple vitamins, hoping it will help with brain fog. Also good advice focusing on gratitude. And to your point, Pierre, a lot of doctors are saying that there is some link with vitamin D and COVID. So we always say to everyone who participates, if you think about going on any supplement, mineral, vitamin, etc., please check with your doctor and pharmacist.
Especially if you're taking any prescription medication, to make sure that there's no side effects.
Anybody else? Love to hear from you.
We will continue talking about the brain, actually. You may have seen some recent headlines about more that we keep learning about COVID. And some of the recent news is a little bit startling. We're learning that COVID-19 may cause greater loss of gray matter and tissue damage in the brain than what naturally occurs in people who have been infected with the virus. And that was based upon a large study from the UK. Now, we don't know fully what all of this means yet. The study was recently published in the journal Nature, and it's really believed to be the first study involving people who underwent brain scans both before and after having contracted COVID. Neurological experts who were not involved in the research but criticizing it said that it did offer valuable and unique information, but cautioned that the implications of the changes were unclear and did not necessarily suggest that people might have lasting damage or that the changes might profoundly affect thinking, memory, or other functions. The study involved people ages 51 to 81 and found shrinkage and tissue damage primarily in brain areas related to sense of smell. Some of those areas are also involved in other brain functions. So the study also included 785 participants in the UK Biobank, which is really just a repository of medical and other data. And it includes about 500,000 participants across Britain. Now, the participants underwent 2 brain scans, roughly 3 years apart, plus some cognitive testing. In between their 2 scans, 401 of those participants tested positive for the coronavirus, and all were infected between March 2020 and April 2021. So I did more digging into this study. I'm not a headline person, and I really wanted to read the actual study. Now, with normal aging, people lose a tiny fraction of gray matter each year. That's normal. For example, in regions related to memory, the typical annual loss is between 0.2% and 0.3%. But COVID patients who were in the study underwent their second brain scan an average of about 4.5 months after their infection. They lost more matter than their non-infected participants, experiencing anywhere from 0.2% to 2% additional gray matter loss in different regions of the brain over the 3-year period between the scans. They also lost more overall brain volume and showed more tissue damage in certain areas. The effects might be particularly notable because the study involved mostly people who, like the majority of COVID patients in the general population, were mildly affected after their initial infection, not becoming sick enough to need hospitalization. So I know it's a lot of scientific jargon. In very simple terms, a large study found that the brains of people who had even mild cases of COVID were affected by the virus.
So Elliot, so are you saying, so did people in the study experience symptoms related to brain function?
It's an excellent question. The answer is we really don't know. The study is based upon routinely collected health data from participants. We actually have a very similar study here in the US, and Canada does its own. It's called the National Health Survey. There would have been no way to recruit people ahead of the pandemic to determine how COVID infection might affect the brain. So the study is based upon health records, the information about people's symptoms, including whether or not they even lost their sense of smell, is not always included. The researchers also could not identify whether patients had long COVID, so it's unclear if these findings relate to that long-term condition. Differences between infected and uninfected people increased as well with age. We don't know if that's because younger people recover faster or if they were not as affected to begin with. So really the cause of brain damage is rather unclear. And the authors mention theories, including inflammation, evidence of which has been found in other studies, and sensory deprivation from disrupted sense of smell, and even possible isolation or other mental health issues that people have experienced during the pandemic, which are not easily measured or reflected in this overall data. I think the study's greatest value might be the indication that there has been something that has happened to the brains of people who have been infected. Other scientists can now build upon those findings to figure out what exactly is going on. It's no cause for panic or a trip to the doctor for a brain scan if you've had COVID. It's just something to be aware of. We're learning more about new things, about how COVID affects different parts of health and human function. There's also so much controversy about COVID, and it's important, I think, for all of us to be more aware as this kind of research comes out, that we need to treat it with some level of scrutiny. Because again, much of this research is coming from data that is routinely collected and not based upon the actual experiences of patients like we would see in a clinical trial, for example. In a clinical trial, half people might get a sugar pill, whereas the other half might get a medication to see if it worked. There would be no ethical way for us to conduct research to intentionally expose people to COVID and see how it may or may not affect their health and function. So I think if this experience has taught us all one thing, it's that we need to be able to better understand science so that we feel more trusting and more in control. And I really think that thinking more critically about the news that we receive is part of that.
That's a lot of information, but thank you. I just wondered, maybe somebody has any questions.
Please, folks, you can unmute your phone by pressing *6 or unmute your Zoom line. We would love to have you be part of our conversation. Elliot, I wanted to ask you, since you read the whole article, did they control for dementia?
They did not. They looked just at a general population and they were comparing data. But what is interesting to that point is that they found that there was more damage among older people who were part of the study. So we don't know, if that might have also been as a consequence of dementia or related Alzheimer's. There may have been deterioration in a person's mental health or cognition over the period between those scans. And we don't know if that was accounted for. It's an excellent question.
Thank you. I know I was on with a dementia expert a couple of weeks ago, Dr. Tam Cummings, and she was talking about the loss of brain weight as dementia increases, the different stages of dementia. So I thought that might be significant.
So the study found similarly a loss of brain volume, which is concerning. My interest or intrigue in this particular research is that we don't know how this may link to future development of Alzheimer's or dementia, if there is a link to this because of COVID. So we don't know the long-term implications. And I think that's really what we're just beginning to really identify, is that COVID affects many parts of the body. We know it can affect inflammation, the heart. Now we're seeing the brain.
Well, thank you for that. Throughout the sessions that we've been providing, we like to provide an update on long-term care as part of our ongoing programs focused on caregiving and COVID. The AARP Public Policy Institute has been analyzing data on COVID-19 in nursing homes, tracking impacts and reporting on key findings since June 2020, including vaccination rates among nursing home residents and staff since July 2021, and booster shots since December 2021. Their latest report from February dashboard shows that the impacts of the surge in Omicron variant included recording rates of COVID-19 infections and staffing shortages. Again, this is another learning lesson for all of us. We don't know what variant might be upon us, and we should learn from the recent surge. The fact that we now see that there is really shortage of staff in long-term care. So if we look at this map, which shows the percentage of fully vaccinated and boosted long-term care residents, it's concerning that some of these percentages are not higher.
Absolutely. If you look at this in places like Texas and Florida, the percentage of fully vaccinated and boosted residents is under 50%, which is concerning given that the restrictions are being lifted right now in most places. Now, again, this data reflects up to January 23rd. However, think about when you got your booster shot. If you're like me, it was probably before that time. We know that the rate of boosters has gone down. Actually, it's been waning. So I wouldn't expect to see huge increases in these numbers. More concerning is that the report found that in January, during the Omicron surge, resident cases of COVID went way up. In January, cases were more than 8 times as high as in the previous month. More than 1 in 8 residents contracted COVID during that month, which include 2 of 4 of the highest weeks of cases in the whole pandemic. 21 states had a higher rate of cases in January than during any other 4-week period tracked by this dashboard going back to June 2020. The other thing, Lucy, that you mentioned is that we've had a lot of staffing shortages and that this has increased. The percentage of nursing homes reporting a staffing shortage of nurses and aides had been holding steady for about 4 months now at 30% shortage. With the surge in COVID cases, the percentage of nursing homes reporting a staffing shortage in January jumped to a pandemic high of 39%. The rate of resident deaths from COVID in January more than doubled, from about 1 in 660 to 1 in 300 compared to the prior month. The death rate remains lower than at any other time in 2020 before vaccines became available, but this most recent 4-week period saw the highest death rate in almost a year. So there's some initial evidence that these trends have continued through February, but the data unfortunately is not yet published in order for us to share that today. The AARP update is concerning, as we can see that despite our vaccines, Omicron's highly contagious strain was visible in outbreaks. And now we're hearing that the BA2 Omicron variant, the new variant, is even 30% more contagious than Omicron was. So this means that for caregivers whose loved ones are in long-term care, please keep open communication with your loved ones, with staff in the facility if you can. Please continue to monitor the precautions that the facility is taking. Make sure that your loved ones are boosted and that they have preparedness items like masks and hand sanitizer, and speak with your loved one's primary care provider as it comes to future boosters that may be needed. We've talked a little bit today about a 4th. The data shows us that long-term care is still an area of concern. Also, these staffing shortages are important to keep in mind and to keep in communication with your loved ones. Do whatever you can to make sure that they're receiving adequate care and that they're also occupied and entertained. Keep on making care packets. We've talked a lot about those. And, we know that there's still some disruption to regular activities. So, whatever you can think of to put together and do to keep your loved ones occupied is important.
You're so right, Elliot. It must be so concerning, especially what you're reporting. I think it's so important to visit your loved one as much as possible, if you can, to make sure that they are well looked after, looking for possible signs of neglect, like they could have a weight loss, bed sores, bruises, or any other injuries. As well as recognize if your loved one is withdrawing or becoming depressed. I know it's more difficult when someone has dementia, but even if they cannot speak to you or tell you that what is actually going on, their body language is going to tell you a lot. So I think you really also, as Elliot said, try to connect with the staff so that they recognize who you are, and possibly ask them if there's certain times that can you help in any way. And I know some of the caregivers that I deal with, they've made it a point to actually go in around meal times, okay? Because one of the things to really make sure that their loved one, and it was very much appreciated. Again, you have to be careful with that. You have to be comfortable with that. And it's also really important to let the staff tell them that you appreciate all they're doing under the circumstances. Make sure that your loved one is really stimulated with activities that may not be provided, as Elliot said. You could bring things like coloring books, any kind of activities, all the things we've been telling you all along. But it's still time to do those things. And there could be music, there could be sing-along, whatever. Go out for a walk as much as possible. And please engage your other family members or friends that are close to the family. And again, they have to feel comfortable to go and visit as often as you can, just to be there and to make sure that your loved one is well taken care of. Now, as wonderful as it is that things are turning the corner, it's also presents a new source of stress for many caregivers. So we talked about that. As we mentioned earlier, with COVID-19 cases are down, they're still out there, and as restrictions are being lifted, This presents concerns for people with certain health conditions. For most of us, there's also mental health stress from this experience. If you can imagine our experience of COVID as being on a treadmill, when you get off the treadmill, you need some time to catch your breath. I think that's exactly what's happening to all of us. You know, the same is true for many people right now who are trying to find their way back to whatever normal living is now, as we try to live with COVID rather than living with restrictions. So we know that it's not going to go away there, you know, but we don't have to, we're not living with restrictions, but we're still living with a lot of uncertainties. We've talked before about the fact that cases of major depression disorders and anxiety disorders have increased for more than 25% worldwide, according to a world first study of the impact of COVID-19 on mental health that was published in the medical journal, The Lancet. This study is the first to access global impacts of the pandemic on major depressive and anxiety disorders, quantifying the prevalence and the burden of the disorder by age, sex, and location. This study found that COVID-19 pandemic has really shown many social inequalities that predispose people to developing mental health. The research found that cases of major depressive disorders and anxiety disorders increased by 28% and 26% respectively, with women affected more than men and younger people affected more than older age groups. So really very much what Evelyn was pointing out before. We always said there were two pandemics going on. And one of them now is kind of, the restrictions are a little bit less, but the mental health one is still there, okay? So we've put some tips together on recognizing symptoms of what you can do about it in these cute little boxes that Elliot did, not me, because he's very creative. So it makes for an easy thing to print and keep handy when you need to be reminded. So you can print it out, put it anywhere. And I have to tell you, it's really important to be mindful of your mental health. So recognize the symptoms of stress you may be experiencing, acknowledging them, feeling irritation, anger, or denial, feeling uncertain, nervous, or anxious, feeling helpless or powerless, lacking motivation, feeling tired, overwhelmed, or burned out, feeling sad or depressed, having trouble sleeping, having trouble concentrating. You know, experiencing or witnessing life-threatening or traumatic events impacts everyone differently. In some circumstances, the distress can be managed successfully to reduce associated negative health and behavioral outcomes. In other cases, some people may experience clinical significant distress and impairments such as acute stress disorder, PTSD, compassion fatigue, and burnout may also result from chronic workplace stress and exposure to traumatic events during COVID-19 pandemic. So we always like to leave you with some tips. And I know for some of you, you've been with us before, so you know these tips, but it's just kind of reinforcing, because I have to reinforce it to me too, tips to keep and enhance your resilience. So talk openly about how the pandemic is affecting your quality of life and your work, identify factors that cause stress, and work together to identify solutions. Ask about how to access mental health resources. We all need it at some point in our life. You do not need to be embarrassed about it. Remind yourself that everyone is in an unusual situation. Identify and accept things which you do not have control over. That was a big one for me too, to accept that. Recognize that you are performing a crucial role in fighting this pandemic, and that you are doing the best that you can with the resources available. And for caregivers, I want to say this has been some challenge, and we recognize what you're going through, and give yourself kudos. Increase your sense of control by keeping a consistent daily routine when possible. Very important. Ideally, one that is similar to your schedule before the pandemic. Try to get adequate sleep, make time to eat healthy, spend time outdoors, either being physically active or just relaxing, and do something enjoyable every day. Like Evelyn knows, I dance around my apartment listening to music and I laugh at myself, and it makes me feel good. Take breaks from watching, reading, or listening to news stories, including social media, hearing about the pandemic, and even about the war that's going on right now in Ukraine repeatedly can be upsetting and mentally exhausting. So I listen to the news only once a day, which I used to be a news junkie before. If you feel you may be misusing alcohol or other drugs, including prescription or even over-the-counter medications like sleeping pills and pain, please call your doctor. Okay, engage in mindfulness techniques such as breathing exercises and meditation, whatever you feel makes you feel better. However, if you're being treated for mental health condition, continue with your treatment and talk to your provider if you're experiencing new or worsening symptoms. Know where to go if you need help, okay? It's out there. If you feel overwhelmed with emotions like sadness, depression, anxiety, worst case scenario, suicide thoughts, here is a distress hotline. You can call or text at 1-800-985-5990. All these resources, Elliot will talk a little bit more about it, you will be receiving.
Yes.
So Elliot.
We always send all of our registered participants a copy of our presentation slides so that you don't have to worry about getting everything right. That's why Lucy was saying you can print these out too and keep them on your fridge or your desk if they're helpful. The last thing that we also wanted to share was about getting your at-home COVID tests. The US government is again distributing free COVID tests at home. These are the rapid tests. And I had mentioned during an earlier talk that we had that when the first round of these free rapid tests went out through the US Postal Service, it was during some winter deep freeze situations, and our rapid COVID test should not be exposed to freezing temperatures. So now that things have warmed up a little bit, do be sure to sign up at the website at the top of your screen and get COVID tests for yourself or your loved ones. They're sending four additional tests to each household address right now. So before we adjourn and Evelyn shares all her great information, I just wanted to open it up, last opportunity for any questions or comments.
Let me see, I had one. Lisa at the senior center said it was extremely hard on the seniors during COVID, but that it was coming into an empty building was hard on the staff too. And of course, those staff are caregivers. And Pierre said, thank you so much. He's going to be sharing this information with others, which is always great. We want you to do that and also to tell them about all of our podcasts on www.caregiverteleconnection.org. So any other comments? Anybody have a last comment? Okay, then I will go ahead and talk about some of the upcoming sessions. We are so lucky we had a big full calendar this month, in spite of it being a short, no, this isn't the short month, this is the long month, okay. Next Tuesday, I am going to be presenting. I am a licensed clinical social worker and have been working with caregivers, elderly and disabled people for over 50 years. And I'm going to be presenting on anxiety, good or bad. I would love to have you join me. I'd love to have your comments, your suggestions for how to deal with such things. And is there good anxiety? We'll find out. March 24th, we've got one of our very favorite guys, Dr. Jamie Heisman, who will be talking about Take Your Oxygen First, which is the name of the book that he wrote with Lisa Gibbons. And on March 29th, we will have what is hospice and what is palliative care? Is there a difference? And if there is, what is it? So those would be very interesting ones. And I want to let you know that as Elliot said, you will be receiving a post-session questionnaire in a couple of days. It will include all of the resources, any of the resources that we've discussed today, unless you're not registered for this session. So if somebody gave you this phone number, what you want to do is call customer service 866-390-6491 and get registered. And you'll hit the jackpot, because then you'll get the monthly calendar that gives you all of the sessions that happen every month. So that's a really good thing to do. I want to thank our expert speakers so much. Elliot and Lucy, I mean, for me, you have been an educational fountain over the last 2 years.
One quick little last drop. Amazon just started promoting at-home rapid tests that they're shipping through Prime delivery for $7.50 per test. Just as a reminder to everyone, $7.50 is great, but if you are covered on Medicare or if you have private insurance, that covers any at-home rapid tests up to $12 per test. So just a little bit there, because I know Amazon's doing quite a big push to get their $7.50 rapid test to people. So that's why we wanted to provide the free resource through USPS.
And is that the clinically accepted test or not?
Yeah, they are clinically accepted, but there's a whole bunch of clinically accepted tests right now. In fact, the ones I received from the government this second round were different than the ones I got the first time. So don't be surprised by that.
Okay.
I also want to remind everyone we're having a session tomorrow, right, Elliot?
Yes, we are.
Oh gosh, I'm sorry.
It's okay for healthcare workers. It's our last session. It's been extremely exciting to do that. So please join us. The other thing I also want to sort of end and just, I know that I was talking about looking at the positive aspect of any experience that we go through. It's been very helpful for me to kind of identify, and I'd like each one of you to kind of think about that, so that there is something that's not all doom and gloom, and we can move forward and live our lives. And caregivers, thank you so much. And all of you healthcare workers that are on with us, I really want to thank you for everything that you've done.
Thanks to every participant for what you do.
Absolutely.
All right, folks, I'm going to turn off the recording now. Thank you so much for joining us. We hope to have you with us again very soon.
Bye.
Thank you so much. Bye-bye.